Part of National Nurse Practitioners Week with a projected shortage of nurse practitioners. The American Association of Nurse Practitioners is working to help address the concerns. And joining us today is Dr. Stephen Ferrara, president of the association, and Kelly Rojas, a student in the Doctor of Nursing Practice program at Columbia University. Thank you both so much for joining us.
Thank you for having us.
Thank you, Amber.
And so many people, I know myself included, you go to the doctor's office, sometimes you actually are helped by a nurse practitioner, and some people may not even realize it. But for those who are not familiar with the roles that they take, tell us what they do within the doctor's office.
Sure. So nurse practitioner is first a registered nurse that has completed undergraduate programming, have returned to school for additional education and preparation. And nurse practitioners can prescribe in all 50 states, can diagnose, assess, and treat. And one of the things that nurse practitioners typically focus on is health promotion and wellness, and incorporating that into every visit that patients have with them.
And right now you all are noticing a decline of students that are coming out of the nursing practitioner programs. First, can you just tell us, if you even know, some of the reasons behind that?
Yeah, so initially we saw, after the pandemic, we saw nurse practitioners, we had an increased interest in nurse practitioners. Now things have kind of come back down to normal, but nurse practitioners is still a very popular profession. There are now 385,000 nurse practitioners across the U.S., which is actually an 8.5% increase from the last time that number was reported. So we're actually seeing some increases in the numbers of nurse practitioners.
And what are you all doing now just to try to get more people into this program?
Well, so Kelly here, as a student nurse practitioner, can tell you what she's doing.
Absolutely. So I am a first-year doctoral candidate at the Columbia University School of Nursing for family nurse practitioning. So I'm very early on in my career. So I just finished up a clinical rotation, and I'm also doing didactic courses. So the rest of my schooling will consist exactly of that. It's just didactic courses and really intense clinicals.
And Kelly, what drew you to the profession?
Absolutely. So being a first-generation Latina woman, my family and I had to sort of go through many adversities. And one of those adversities that they went through was lack of access to routine health care. So this is sort of where my passion emerged to pursue a career in nurse practitioning, is to sort of form a bridge between underrepresented populations and equitable access to health care.
And I'm sure the shortage definitely impacts the care that's being given to different facilities. And so can you all touch on that for a moment?
Sure. There are over 100 million patients in the United States that lack access to primary care. And those are in all settings, whether they're rural, urban, or suburban. So we know that nurse practitioners are leading the way and are making sure that patients have access to high-quality health care through nurse practitioners.
Thank you all both so much for coming in. Real quickly, where can people get more information if they are interested in the program and want to sign up?
Yeah, so we would encourage you to visit wechoosenps.org, which is our website that has all of the information about nurse practitioners. For patients, you can find a nurse practitioner yourself if you want to visit a nurse practitioner for your health care. And we'd also like to thank the 20,500 nurse practitioners in the state, and thank you, Governor DeWine, for declaring this week NP Week.
Well, thank you all so much for coming in. Again, valuable information, and of course, we'll have this on our website as well if you did miss anything. We'll be right back after this.